this is my cardiovascular and pulmonary assessment. And so what I would do for this is first I would gather my equipment, which is only my stethoscope today, and I would come into my patient's room and I would introduce myself and I would state my title and provide for privacy and wash my hands. So, Riley, my name is Catherine Beggs, and I'm a registered nurse here at Mercy Hospital, and I'm going to be performing a cardiovascular and a pulmonary assessment on you today, okay?
Okay.
So the first thing I would have him do is take off his top, and I would be looking at his chest for various different things. I would be checking his skin, always checking the skin, and I would be looking and palpating for any masses, any tenderness, any, or I would be checking for symmetry for his breathing and for his chest and bone structure and muscles. So again, I would go ahead and palpate. He's in obviously no distress. His breathing is equal. Everything feels normal. There's no masses, abnormalities, any tenderness anywhere, any soreness, any pain. Okay. Then I would check for tactile fremitus. How I would do that is I would place the heel of my hand on his chest, starting in the underneath his clavicular line, and I would have him say 99.
99.
And I would go from one lung field to the other, side to side, so I could check to make sure that it's equal vibration on both sides.
99. 99. 99. 99. 99.
I would do it for front and back.
99.
And I would be sure to avoid his scapula, because the scapula dulls or prevents any of the vibration from going through.
99. 99. 99. 99. 99.
Okay, let me try this again because I didn't go from side to side. So
99. 99. 99. 99. 99. 99. 99.
okay. And I will next check for symmetric expansion. I'm going to go ahead and have Riley stand up and turn around so I can demonstrate how I would do that. I will go about the 10 clavicular intercostal space, So right around in here. And I'm going to take my thumb, sorry son, and I'm going to pinch his skin together, and I'm going to have him take a deep breath. And both of my fingers expanded equally, so therefore we have symmetrical expansion. You can go ahead and stand or turn around and get back on the bed. Next, I'm going to percuss all of the lung fields. I'm going to do that by taking my fingers and I'm going to spread them apart, and I'm going to tap. And I went down a little bit further than where his lungs actually were, just so I knew where they ended. And I'm going to do the same for the back. Again, avoiding the scapula. Okay. Then I'm going to be doing, I'm going to auscultate all of his lung fields before I do any other tests. I'm just going to listen for any sounds. I'm going to listen for any crackles or any coarse sounds or normal breath sounds or any other abnormal breath sounds as well. Starting at the top. Take a deep breath. Oh, let me switch that around. Now. Okay, can I go ahead and have you go like this with your arms so I can listen on your sides as well? Okay, that was actually checking for the right lung actually has 3 lobes, and I was checking that middle lobe. Deep breath. Okay. Then I'm going to be performing the whispered pectoriloquy test, and I'm going to do that by placing the stethoscope on the front and the back. First I'm going to be doing the front, and then I'm going to be working again from side to side to make sure that there is no difference between lung fields, and I'm going to have Riley whisper the numbers 1, 2, 3 as I touch, and I'm going to be watching his lips to make sure that he's saying it but that I cannot hear. This checks for consolidation or any masses or fluid within the lung.
1, 2, 3.
You have to whisper it, okay? And I'm going to be doing it on your back. I heard no sound, so that's normal finding. Next, I'm going to be doing the bronchophony, and I'm going to do that by placing the stethoscope again, front and back side, and I'm going to be having Riley say 99, and I'm going to be listening for equal vibration as I go down his lung fields.
99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Then last I'm going to check for egophony, and I'm going to do that by having Riley say the letter E, and I should hear the letter E. I should not hear the letter A. If I heard the letter A, that would indicate that there was consolidation within his lungs.
E. 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 E.
Then the back.
E. 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 E.
I heard the letter E throughout all lung fields, and on these tests I avoided the scapula as well. That ends the lung portion of the assessment, and now I'm going to be moving on to the heart portion. And in order to do a heart portion or a heart assessment properly, I need to move to the right side of my patient. And the first thing that I would do is I would visualize, and I would do a physical assessment by starting out with just inspection. Always inspect first, and I have already done that with the lung field, so I'm going to go ahead and move on to the heart valves. The first valve that I'm going to be assessing is the aortic valve, and it's located at the second intercostal space at the mid-clavicular line. So I would map out. So here is the clavicle, and I go down 1, 2. And then I'm going to go to the pulmonic valve, and then that is the second intercostal space on the left side. Next, I'm going to move to the tricuspid valve, which is the fifth intercostal space on the right side. And it is located more closer to the sternum, to the mid-sternal. And then I'm going to be listening for the mitral valve, which is the apex of the heart, and it is located in the fifth intercostal space, but it is located on in the middle of the costal. And then I'm going to listen to them all with the bell. Pulmonic, tricuspid, and then mitral, okay. Next, I'm going to be performing a full minute apical heart rate. I won't perform it the whole entire time on here, but in the real world I would. And how I would do that is by timing on a clock, and I would count his beats, and I would make sure that there was no skipping or any other noises or any other irregular rhythm. Okay, so that was just for demonstrational purposes. I don't want to spend a whole entire minute on that. Then I would palpate and auscultate the carotid arteries on him. You don't want to do right underneath the jawline because that could cause a vagal response. He has a strong pulse right here, and you only want to do one side at a time. He has a strong pulse right here, and they were equal. I did not feel a thrill. I will go ahead and auscultate as well. I'm going to go ahead and use my bell. Can you sit still? Okay, they're even. And that ends my pulmonary and cardiac assessment. Thank you.